Welcome to The Exchange. I'm Dan Riley. The Exchange is a streaming internet talk show and podcast of interviews with noteworthy people about their lives, ideas, and current events. This week I sit down with UCSF resident John Hartmann. During our conversation, John talks about the history of psychedelics, recent medical studies on the effectiveness of psychedelics on treating addiction, depression, and other ailments, and the timeline of when these substances may become available as legal medical treatments. Welcome to the show. Today I'm sitting down with John Hartmann, a fourth-year resident at the University of California, San Francisco in the psychiatry department. John, thanks so much for taking time and welcome to the show.
Thank you.
I'd love to start just by kind of learning about your interest in psychiatry. Have you always wanted to go into what you study now and the field that you work in?
No, it was really something that developed over time for me. I had taken some psychology courses during undergrad. I think at that time it was definitely an area of interest. But I went into medical school not really knowing what I was going to do, kind of thinking that it would really leave the door open to doing a lot of different things. And then I think I just was fascinated by talking with the patients in psychiatry and found myself really fascinated with their stories and getting to spend more time with patients and kind of relate to people in a different way. I just really found that compelling. And after doing some rotations in psychiatry, had no doubt that there was anything else I'd rather do.
What are some of those stories? What are the people that you met? What kind of things do you remember about them that got you particularly interested in them?
It's a good question. I remember doing a rotation at University of North Carolina, Chapel Hill, in psychiatric emergency services there, and just having people come in kind of in crisis and being kind of the first people they're talking to when their life is basically in chaos, and I don't know, feeling just it felt like a special thing to be able to be there for people in that kind of crisis mode. I can definitely remember some of the people that I worked with, but it's more just the general impressions of being there in that state with somebody that really sticks with me and that I think drew me to the field.
People who are in crisis mode like that, is it generally brought on by stress or by genes or by all of the above? How do people get to a point where they really end up in the emergency room of a psychiatric wing?
That's a good question. I'd say generally, the vast majority of the time, there's some kind of stressor. There's something that happened, either a major loss or some kind of conflict or something that we would call a psychosocial stressor that tips somebody over the edge. But typically there is some kind of predisposition to it. Either it could be genetic. It could, sometimes people have a family history of either depression, anxiety, psychosis. But generally, something major happens that really kind of pushes somebody over the edge of, their ability to cope with something that really feels traumatic or feels stressful. So that's when they come to us, either feeling, overwhelming anxiety or suicidal thoughts, or sometimes, going into kind of a psychotic kind of place.
I'd love to know kind of what's the difference between how we kind of treat people that have psychological disorders or in that state where they come into a hospital or a psychiatric wing and they need your help, now versus 50 years ago or 100 years ago? I mean, how much progress generally would you say has been made, and what's the difference of kind of how those people are viewed from a medical perspective?
That's a good question. Things have definitely changed significantly. The major difference now is that we have more medications to help people in that acute phase. For people that are having an acute psychotic episode, we have medications that we can give to help calm down either the voices or the paranoia. And 100 years ago, people, we didn't have those. And so there was, much more, there was need for, calming patients down, but in like a forceful manner. So more use of restraints, seclusion. We try to avoid those these days. And I think medications help quite a bit. And then for, anxiety and depression, I think, we also are able to address that to some extent with medication, although, a lot of these illnesses are things that take a long time to really get a handle on and to treat. But at least the acute phase, I think we can deal with in a more humane way than we could 100 years ago.
It seems like, from the little that I know about it, it does seem like it used to be viewed, those, if someone broke into a psychotic state or was severely depressed, that would be was viewed historically as a character flaw. That was something that was an internal issue that someone was not capable of dealing with. Has that changed? Is there a medical consensus now that these things don't necessarily have to do with your character, but perhaps are more biologically based?
Yeah, it certainly has to an extent. There's still quite a bit of stigma around mental illness, but it's there's evidence that's accumulated that shows us that these illnesses are heritable. They can be transmitted through families. So there is a genetic component, and I think that helps take some of the stigma away. But it's certainly not gone. People still often have trouble seeking treatment because of the label, not wanting to have a label. So it's certainly changed, but it's still got a long way to go.
Mm-hmm. So we got connected because of a mutual friend who learned about a presentation that you recently gave at UCSF about psychedelics and the use of psychedelics now, or at least the beginning of research involved with psychedelics in dealing with addiction, I believe was the presentation that you gave.
That's right.
The psychedelic industry as a whole talk about stigma is a part of American society that has just sort of been demonized for almost its entire existence, it seems like. Before we get into the medical aspect of what's being introduced now, what's the reason for that? Are there specific reasons why medical research has been limited with psychedelics, why psychedelics generally are viewed with such suspicion in our society?
Yeah, so a lot of people don't realize, but psychedelics were not always demonized. They were actually studied as therapeutic tools back in the late 40s, early 50s, and pretty much up until the 60s with the kind of explosion of recreational use. There were over 1,000 clinical papers published, over 40,000 patients treated, and they were taken seriously by academic researchers. And this was all, a lot of this was before LSD was being used on the streets. But it was really the crackdown happened in the late 60s, early 70s, due to widespread abuse and consequences of recreational abuse. And it really took a long time for that the kind of reactionary stance of American culture to reintroduce these in kind of a safer way. People still, have some. There's certainly still stigma around these drugs. People think of psychedelic drugs, and they generally think of the '60s. They think of Grateful Dead. They think of Jimi Hendrix. They think of people having freakouts and being in emergency rooms, and maybe Charlie Manson. Like, there's a lot of pretty significant not that there's anything wrong with the Grateful Dead, but there's a lot of non-medical kind of associations with these drugs now. And so really it was a good 30 years. There were maybe one or two studies done during that time, but it was a good 30 years where no research was done, really. And Johns Hopkins really got this study with psilocybin through their IRB. They got DEA approval. They were able to do the study. And they were the first ones to kind of start the ball rolling again, and show that it could be done by serious academic researchers. And they had to kind of fight through the stigma, but there's a lot of evidence that these are safe physiologically. People don't overdose on these drugs. They don't cause dependence, unlike a lot of other drugs that are, in the Schedule 1, the highest classification for drugs of abuse. These ones, they don't cause dependence. In fact, we're trying to use them in the context of psychotherapy to treat drug dependence. So these guys at Hopkins, Roland Griffiths and his co-workers have shown that, we can, they've laid out a blueprint for how to do these studies. They've shown the safety, that they can be safely administered to healthy people, and, without any significant adverse side effects.
Before we get into the studies too much, when we say psychedelics, what does that mean from a scientific or medical standpoint? What's the difference between a psychedelic and some other drug?
Good question. So the word psychedelic has been used kind of synonymously with hallucinogen. I actually like the word psychedelic more because I think I think the word hallucinogen is kind of misleading. Psychedelics don't normally actually cause true hallucinations. And the word psychedelic in Greek means mind manifesting. And so there's a kind of an idea that it catalyzes some kind of mental experience, some mind opening type of experience. But what defines a psychedelic drug is that it fits in a particular receptor, the 5-HT2A receptor. It's a subtype of a serotonin receptor. And drugs that activate this receptor are many of them have psychedelic type effects. So that includes LSD or acid, psilocybin, which is the active compound in mushrooms, or mescaline, which is active compound in peyote. Those are the three common ones that are thought of that kind of encompasses psychedelics.
And is there one particular person or an experiment that discovered psychedelics and brought it into the Western culture? What's the history of where psychedelics have been used, and how did it come to America?
A lot of interesting stories around that. So there was a Swiss chemist named Albert Hofmann who was actually researching drugs that he hoped would help stop bleeding, that would have some kind of hemostatic effect. And one of the drugs that he synthesized was LSD. He actually didn't find this class of drugs to be very helpful for what he was studying them for, and put them on a shelf. And for some reason, 10 years later, I think it was 1943, decided to resynthesize these drugs. And the story goes that he was working in his lab, and he felt a little bit off, felt like something was different, and thought that it was possible that he had accidentally ingested some drug, either because, through his skin or aerosolized. And so he decided to test the compound on himself, which is something that medicinal chemists did back in the day. But starting with a dose that was lower than any imaginably, effective dose. So a quarter of a milligram, which happens to be a pretty large dose of LSD. And so he, in 1943, administered the first dose of LSD on purpose to a human, and ended up riding his bike home through Basel, Switzerland, and said he, had a terrifying experience of, kind of psychotic-like phenomenon, and was just, so he was the first one to have the LSD experience. Sandoz, the company that he was working for, ended up sending samples to psychiatrists around Europe with an interest in studying kind of the psychotomimetic effects of LSD. And also, I think initially it was more to study, how these drugs mimic psychosis, but also it wasn't long before people got interested in potential therapeutic uses for them as well. And then for mushrooms, mushrooms have been used for millennia in the Central America, and it wasn't until 1957, I want to say, that an American banker by the name of Gordon Wasson went down to Mexico and found a woman who was giving these mushrooms, or I guess using these mushrooms in kind of a sacramental ritual context. And so this was after LSD had, kind of been introduced to Europe. Mushrooms kind of came on the scene for the Western culture a little bit later, like in the late 50s. So yeah, lots of interesting history behind those two.
So the mushroom ceremonies, and that was my understanding too, and I think generally with my understanding about peyote was that it was also a part of ancient rituals as well in Central American cultures. Do peyote and mushrooms can they be produced naturally, whereas LSD can only really be synthesized through a long, elaborate science procedure?
Yeah, that's right. There are a number of species of mushrooms that have psilocybin naturally produced, and there are just a few types of cacti that produce mescaline and related alkaloids. And yeah, you're right. LSD is a synthetic, or at least a semi-synthetic product. There are things in nature that are somewhat similar to LSD, but it's not something that's found naturally. Yeah. So
just to clarify about the initial discovery of LSD. So the Swiss chemist was literally trying to discover and create some sort of a material or substance that would allow for the closure of cuts. Was that what he was trying to do? And just by pure accident, he ends up creating LSD.
Yeah. So my understanding, and I'm fairly certain, but not 100% certain about this, is that Sandoz was looking for drugs that could be used for childbirth, for postpartum hemorrhage. And there are drugs that are very similar that are used to stop bleeding with postpartum hemorrhage, that have a very strong kind of hemostatic effect or clotting effect.
And of the three that we were just discussing, acid, peyote, and mushrooms, are there very important differences between the three in terms of what the experience would be like? And how about the intensity, or the difference in intensity between the three?
So generally people who have tried the different substances say that there are subjective or qualitative differences between them. But as far as intensity, I think it's dose dependent. They're, at a certain dose, they are rather mild, but at a higher dose, they have very intense effects, and all three of them can have intense effects. They have different durations. So most of the studies now are using psilocybin because it's shorter acting. It generally lasts from 6 to up to 8 hours, whereas LSD and mescaline last 10 to 12 hours or longer. So it'd be hard for researchers to, be present for a 12-hour drug trip compared to 6 hours is much more manageable.
And the reputation, I remember being raised and having the understanding that psychedelics wasn't necessarily a guarantee, but a distinct possibility of consuming psychedelics would be going into a permanent state of psychosis for the rest of your life, where you would never be able to kind of break out, or that you would at least be fundamentally changed psychologically if you took these drugs. Is there any proof that that's true? And if so, how frequently does that happen?
There is a lot of fear and kind of hysteria around these drugs, and there's really not any evidence to support that idea that they cause psychosis. And back in the 60s and 70s, as I said, tens of thousands of patients were treated, and the rates of psychosis were as low or lower than what we'd expect for just the population at large. So extremely small. And there is some kind of anecdotal evidence that for people who have a predisposition to a psychotic illness like schizophrenia, that using psychedelic drugs, or marijuana for that matter, can unmask mental illness earlier, because they can be, in the wrong setting, they can be very stressful, potentially even traumatic type of experiences. But as far as causing psychosis in a healthy person, or causing a lasting psychosis in a healthy person, there's not any evidence to support that.
So getting back to the medical testing and sort of the reintroduction of psychedelics as a form of medical research, when did the Hopkins team begin to do their medical research? And talk, if you can, a little bit about what they discovered.
So there was actually a guy, a researcher at University of New Mexico, who first did a study with a different psychedelic called dimethyltryptamine. And he kind of laid out a blueprint for getting these drugs approved. And it was roughly a decade later before the folks at Hopkins started getting interested in trying to do this research. So it was around early 2000s that they started putting together the idea of doing this research. There was a researcher by the name of Roland Griffiths who had a very good track record of doing clinical trials with using drugs in humans, and kind of knew the ropes, and was very comfortable with the research process. And he had an interest actually in meditation and spirituality, and hoped to. I think he was introduced to the idea of studying psychedelics as a possible means of inducing religious-like phenomenon in healthy volunteers. And so his first study was with healthy, normal volunteers, no prior drug experience. These were people who were middle-aged, highly educated. I think 50% had postgraduate degrees, and were just interested in the effects of psilocybin, or interested in the opportunity for intensive self-reflection. And so he had these folks enroll in the study. First study, they were given a single dose of psilocybin. They had preparatory sessions where they kind of oriented people to the experience, and then follow-up sessions afterwards. But really the focus was on this psilocybin session where volunteers lay on a couch for 6 hours. 2 therapists are present. They have eye shades on for the majority of the experience. They have music. But it's supposed to be an introspective experience. So they're encouraged to go inward and kind of go with the experience. And his findings were, so he was looking at a few things. He was looking at changes in mood and behavior, and then also looking at kind of spiritual qualities of the experience. So they had a couple of follow-up points. After the study, they had one follow-up, I think, was at 2 months, and then another one at 14 months. And at 14 months out, participants were asked to rate how personally meaningful was this experience. So we have 6 hours on a couch, controlled setting, and what would you guess? Like, what percent of people would say like this was one of the top 5 most meaningful experiences of my entire life?
I would guess, because I think I've read about snippets about this. I think it's quite high, correct? I mean, far above 50%.
Yeah. So the first study, it was 67%.
Okay.
They did a follow-up where they gave volunteers 3 different doses. So they had 3 different tries, and 95% reported this was up there, top 5. These are people who had children, had been married, had, lots of major life events to compete, with this. But they found this kind of that level of meaningfulness to them. And I think that's incredibly striking. 40% actually said it was the number 1 most significant experience of their entire life. So that is a fascinating thing to me. Now, whether or not that translates into lasting changes in mood and behavior is another question. And this study attempted to get at that. They did ask the patient or the volunteers, and then community observers, either spouses or friends, about changes in mood and behavior. And roughly 70 to 80% in the second study reported positive changes in mood and behavior. Now, I think, when we start talking about addiction or treatment of specific, disorders that will need more specific objective outcomes. But in this group, people thought that the experience was not only meaningful, but it caused lasting changes as well.
And when you say significant, that it's one of the most significant or the most significant experiences of their life. What does that mean, and what's going on in there? What is it? Is it totally subjective? It depends on the person. Each person goes through that experience in a completely different way, or are there themes that are recurring throughout the patients?
So, as I said, this study, they were looking at spiritual type effects, and so they administered scales that were developed in the psychology of religion field to define mystical type experiences, and so they had different subscales of things like sacredness, a sense of kind of deeper truth or meaning, like getting in touch with a deeper truth, a sense of wonder or awe, positive mood. There were 6 dimensions of kind of this mystical type experience, and people that tended to score higher on those 6 subscales tended to be the ones that had more positive, like lasting changes to mood and behavior. And so these are things like that you can measure. They are subjective, but they're things that you can measure like any other, subjective, quality to the experience.
And are there during those tests, the more recent tests, are there any experiences of people going into a psychotic state or referencing during their experience that they were petrified or terrified or had some sort of a traumatic experience, or not really? So
a number of the participants, actually a significant number, had significant anxiety during the experience. Up to, I think, 40% had at least a period during the experience where they reported significant anxiety. I think also a number of the volunteers had transient episodes of paranoia. And so these are kind of things that could become problematic, in an uncontrolled setting. But in this setting where there are 2 therapists present to help guide the experience and ground the participant, they're actually quite safe, and nobody reported feeling harmed by the experience.
And are people generally dealing with some sort of problem that they haven't been able to face prior to this experience? Are they just having an overwhelmingly positive sensation? I mean, it sounds like it's a variety of different states, depending on the person, but is part of the positivity about it and perhaps the long-lasting change almost like an opening up of problem solving in the mind? Is that part of what's happening?
Yeah, I guess I started by describing the mystical type experience, but these are very personal experiences for people. And so there is often a report of kind of new perspective on the self or on the world or kind of relationships. And so getting back to the effects, most people think of kind of the perceptual effects of psychedelics, but the cognitive and the emotional effects, I think, are where that's the more interesting part. People report enhanced introspection, kind of an increased, rate of thought process, kind of a speeding up of thoughts, new associations. So an ability to think about things in different ways. And so for some patients in the studies of alcoholism, people report having just a totally new perspective on their illness, on their alcoholism, and report that they no longer feel a need to drink. There's some very early data coming out on the alcoholism stuff, but there are a number of trials that are underway. looking at that.
So let's get into that. Let's talk about the addiction component of this and some tests that have been done with people who are dealing with some form of addiction. Is it primarily the research that's come out related to people who are addicted to alcohol, or is it a variety of different drugs too?
So the first study that's been done recently was actually with nicotine dependence. And the researchers, this was done at Hopkins. I think they chose nicotine dependence because it tends to be a cleaner addiction. It tends to be people that are maybe slightly higher functioning, that don't have other comorbidities or other illnesses. Often severe alcoholism can come with, a lot of, social consequences that aren't there so much in nicotine dependence. And so that study was very small. It was open label, so people knew what they knew what they were getting. There was no, blind. But the efficacy rate of or the rate of abstinence, I think over a year out was somewhere, I want to say like 70, 80%, like a very high rate of quitting tobacco
altogether.
Yeah. And, there's other drugs, there's treatments out there, and you can't really compare it to other treatments because this was open label, it was small. But treatments like Chantix and nicotine replacement, success rates are much lower with those. And, it's likely it's not going to be 70+% in larger population. But it was found to be quite effective. And these are drugs that, don't interact with the nicotine receptor at all. So it's thought that there's some kind of psychological, mechanism or, maybe some neurobiological component too, but that's allowing people to give up long-standing addictions.
And the people who take the drugs, afterwards when they're asked, what was it about the experience that let you kick a habit that you may have been addicted to for years of your life? What do they say?
It's a good question. The one thing that stands out to me is a woman in one of the alcoholism trials who said that during her psilocybin experience, she forgot that she was an alcoholic. And she kind of saw herself as a depressed person and realized kind of that she was using alcohol to cover up something or cope, and that it was kind of getting in the way of her actually enjoying her life as much as she felt like she could or she should. And so she said it was really the insight for her, as the personal insight of what the role of alcohol was in her life that allowed her to stop drinking.
And is that theme of extracting some nugget of wisdom or some insight from the experience with psilocybin, is that, whether that's realizing that alcohol is masking your depression and that's why you're drinking, is it generally some sort of conclusion that's so firmly felt and certain within that person's mind that they come out of that drug experience and they're kind of changed?
Yeah, I think it's too early to we really don't know what's going on in the psilocybin experience that is causing the lasting change. But there's something that's mediating this longer term effect, because it's not just, you're not just affecting a receptor. There must be something that mediates a longer term effect. You can't, any other treatment requires, daily dosing over a long period of time. So this is totally different mechanism of action.
And when we're talking about alcoholics, is there a certain medical definition that a person must have met, or even someone who is addicted to nicotine, they have to smoke at least this many cigarettes per day or drink this many drinks per day? And if so, what were those kind of verticals?
That's a good question. I don't know for the smoking trial, but there are clearly defined. It's clearly defined, in the DSM, kind of what what alcohol dependence is or what nicotine dependence is. And my impression was that these are people who had a serious problem, not just casual, occasional users. I don't know the exact entry criteria.
Perhaps some sort of physiological dependency on alcohol or nicotine to get through a day, something like that.
That's a good question. I don't know if physiologic dependence was necessary for the alcoholism trial. Okay. But there was a certain number of drinks per week, I believe, that to be in the trial. So I'd have to look that up to know for sure what it was.
You mentioned that in the nicotine study that the abstinence rate a year out was something like 70%. What was the abstinence rate for people that were alcoholics? And whatever that number was, did that mean that they gave up drinking permanently, or they got their drinking down to a level that was tolerable?
So the alcoholism trials are yet to be published. There were a number of trials done back in the 60s and 70s, but the methods were just not up to today's standards. A lot of the trials didn't have they weren't randomized, or they weren't blinded. They didn't even try to blind it, or it wasn't clearly defined, like how they were selecting participants. But there was a meta-analysis done recently that looked at the best design trials. So the ones that did randomize, they had a clear entry criteria, clear follow-up measures. And this study found an effect in favor of LSD-assisted psychotherapy. And even these trials, there was a huge range of kind of how they did things. Some paid a lot of attention to preparing people and having therapists present, doing follow-up, and others, they gave people high-dose psychedelics and didn't really do a whole lot of follow-up. I'm kind of surprised that people didn't get worse in those groups. But they found an effect, grouping the best design studies together, they found an effect in favor of LSD at the first time point. Now there's a research group at University of New Mexico headed by Michael Bogenschutz who have completed an open label trial. And
could you define what that means, an open label trial?
Sure. So open label, unlike a blinded trial, means that people know what they're getting.
Right.
So you sign up and you know you're getting certain dose of psilocybin. A blinded trial, the Hopkins group, they gave one group psilocybin and one group a high dose of Ritalin or methylphenidate, and so they weren't sure what they were going to get. They weren't sure what dose they were going to get.
Right. And
so there was some uncertainty to kind of reduce the expectancy bias. So the open label study was recently completed at University of New Mexico. Now there's a study, I believe it's being done at, just started up at NYU and New Mexico, kind of a two-site study of alcoholism treatment. And these studies, it is different than kind of the Hopkins Healthy Volunteer study because it's psychotherapy. People come in for, I think, 12 sessions usually, and they have typically one or two sessions where they receive psilocybin. But they get kind of standard of care treatment, which has been motivational enhancement therapy, along with the psilocybin treatment. And so those two studies are underway. The open label trial, though, did find that drinking was reduced drastically after the psilocybin session. And so they had people, report their amount of drinking at study entry, and then at 4 weeks after they've been receiving the psychotherapy but not the drug, and then after receiving the drug, their drinking dropped off pretty drastically. I believe that study should be published within the next couple months if it's not already published. But it'll be interesting to see what the bigger studies show.
As these studies come out and as these results begin to get published, is this just throwing a bomb in the field of psychiatry? Or maybe that's not the right way to put it. Is it revolutionizing psychology? Is this something that everybody's talking about and has the potential to really change the way that doctors treat patients who are dealing with psychological issues?
So this is something that people are starting to talk about. It's still very it's uncertain, it's unproven until some bigger studies show efficacy for this treatment. People aren't going to be so interested. But I think people in general, when they learn about what's going on and that early research is somewhat promising, I think people are interested because it is so different. It's just kind of a novel treatment paradigm. We don't have anything else like it in psychiatry, and we have things like ECT, where you do kind of a treatment and you can expect like a pretty significant response. But this is a drug that we're giving once or twice that may have a lasting response, and so there's no other drug treatment like it. No other. It's totally different than anything we have. So I think people will be, if this kind of pans out, I think people will be really interested. I still don't see it revolutionizing all of psychiatric treatment. I think this is, right now we're just looking at addictions. We're looking at, these trials are enrolling people who have pretty good social support. They have, kind of room to improve, and they've got people to help them. I think there's specific target populations that this could be most useful for, and I'm not saying that it's a magic, panacea.
Is there any pushback from certain wings of the medical or science field or from the government itself?
Good question. At this point, there hasn't really been any pushback. I think certain institutions might be less open to allowing this research to go forward. But as far as I've heard, any researcher who has wanted to do this and has gotten the funding has been able to do it. And so I think the big bottleneck right now is funding. None of this research is government funded at this point. So the NIMH, the National Institute on Mental Health, and the National Institute on Drug Abuse have not funded these studies yet. It's all private funding.
Through universities or through other ways?
So it's all privately funded by donors, and there are a few major funders. I think Hefter Research Institute has funded a number of these trials, and they have donors who want to fund this research. And so the hope is that if these phase 2 trials are promising, that the NIMH will start to, think twice about funding this.
For the 30 or 40 year gap between when the studies stopped in the late 60s and, I don't know, the early 2000s, whenever they popped up again, 40 years or so, was it illegal to perform those forms of research, or was it just frowned upon? And if it was illegal, was there a law passed by Congress? How did that happen?
So it never was illegal to do the research. It was, my understanding is that the bureaucratic hurdles to doing it and the stigma, taboo associated with it were insurmountable for years after, the early 70s and kind of the explosion of recreational abuse. And I think just having the stigma fade a little bit and having people a little bit less sensitive to that, it's no longer a career killer to be interested in this research. And so it still requires getting a special Schedule I license that is quite a process to get through, but it is doable. And technically there's no law that's changed, but people are, just more open to letting this research happen right now.
Last question I want to ask you. If someone listens to this who is interested in participating in studies like this, whether they personally have an addiction or they're dealing with, they have a chronic illness or an end-of-life situation where they know their life will be ending sometime soon and they're interested in potentially getting involved, is there somewhere where they can go or something someone who they can email or call to seek this out, to potentially become a part of an experiment and potentially have the sort of effects that we've been talking about tonight?
I wish I could say yes, but the studies are so small right now. I'm not sure of which ones are recruiting. That there's really not much of an opportunity for, the general population to, get this treatment. When it gets to phase 3, we'll be seeing this research done at different sites. There'll be more people doing it. There'll certainly be more openings for patients to enroll. But at this point, the studies are extremely small, I don't personally know of studies that are recruiting at this moment. Although, I know that, I guess I do know that the NYU group and University of New Mexico are doing this alcoholism trial. So I guess, that would be the one place to look, but those are, as I said, really small studies. So.
And just as a quick follow-up on that, you said once it gets to a stage 3 format that there might be more opportunities for testing. Walk me through exactly how those stages work, and is there a stage at which it becomes something that a licensed physician like yourself could potentially write a prescription for someone to participate in a program where they're taking psilocybin for addiction or some other ailment?
Yeah, it's a good question. So their trials start with phase 1 or preclinical, kind of demonstrating safety. Phase 2 is smaller trials looking at efficacy, but with a small population. And then phase 3 is you're doing the same studies with a larger population with the goal of getting the medicine approved, FDA approval. And so typically studies need a certain number of participants to go through the FDA approval process, and that's usually my understanding is that it's in the range of 400 or 500 patients, and at that point, if the medications or the psilocybin-assisted psychotherapy gets approved by the FDA, the drugs would have to be reclassified to Schedule 2 from Schedule 1, which means that Schedule 2 is quite controlled, but there are medical uses for them. And so at that point, it would be possible for certain clinics with certain credentialing, with trained therapists could, administer these drugs in the context of therapy.
And in principle, that could be applied to the entire country as long as those requirements are met.
That's right.
Oh. John, thank you so much for coming on the show. This was fascinating.
Thank you.
Thanks for listening. If you're interested in learning more about The Exchange, want to listen to episodes online, or would like to reach out to the show, feel free to visit the show's website at theexchangeshow.com.